guidance. And so given that the president focused on modeling the best public health advice when masks were required, why isn't he doing more to show the country what you can do once you are vaccinated? Thanks.
So in terms of travel from India, we remain in very close contact with our foreign counterparts and are continuously monitoring the situation. Our current inbound travel precautions and mandatory testing before travel, the quarantine for unvaccinated individuals, and the retesting during that quarantine period, those are all in place for all international travel and have been effective. Getting Americans vaccinated is the most effective tool that we have against COVID, and we'll continue to follow the CDC science-based guidance on travel and other matters. Dr. Belinsky, I don't know if you have anything to add here.
No, nothing to add.
Okay, next question.
Zeke Miller, AP.
Thanks for doing this. First, a quick point of information. When you say 100 million Americans are fully vaccinated, that just means they've gotten their second dose if they've required a 2-dose vaccine. That doesn't mean that they're 2 weeks past that dose, which is
that is correct, Zeke, and that's why I was clear that everyone needs to make sure that they follow that 2-week post. But they now, 100 million Americans have received their second shot if they're on a 2-shot regimen, or their 1 shot if they're on the J&J regimen.
Thank you. And then just following up on Dr. Wensley's point earlier about New York, that July 1st is sort of a reasonable timetable, assuming the current trend lines are continued. Could you explain, Dr. Wensley, sort of what that, what would be possible, or sort of now assumes likely on July 1st, then New York's going to 100% capacity at restaurants and bars and arenas and the like. Will masks still be required indoors? Can you sort of lay out a little bit, sort of 2 months from now, rather, what should the American people sort of hope for?
What I'd like to do is sort of say the more people are vaccinated, the fewer cases that we have. And as we see those numbers come down, we'll take increased steps as we have until now. We've had 3 updated guidances of what you can do if you're fully vaccinated, and we look forward to more as more and more people get vaccinated. But I don't think this virus has tricked us before, so I would like to sort of watch and see how it goes before making further estimations of what happens in a couple of months.
Good. Next question.
Last question. Let's go to Meg Tyrell at CNBC.
Well, thanks so much. I just wanted to follow up on what the administration is doing to counter disinformation. So really stronger on the spectrum of hesitancy. But, Peter Hotez wrote an editorial in Nature suggesting that the highest levels of government have to take direct, even confrontational approaches with Russia and move to dismantle anti-vaccine groups in the United States. So really going beyond counter messaging from the global health community and pressure on social media companies. I just wondered what the administration's sort of stance is on stronger actions like that against specific disinformation, not just sort of hesitancy in general.
Dr. Murthy, you want to talk about just positive measures on information and anything you want to say about combating disinformation?
Sure. Well, thank you for that question. I mean, that is such an important issue, and we are certainly focused on it in several ways. But the 2 that I'll mention is we recognize that misinformation and disinformation thrive in the absence of accurate information. So one of our strategies is to put as much accurate information out there as possible with trusted voices, not only the people from government, but also reputable medical sources and experts in communities. But we are also working closely with social media companies and other platforms to push them also and partner with them on rooting out active disinformation campaigns. I said at the top of this to help address this crisis and get people vaccinated. And I specifically mentioned that we need social media companies and platforms to not only put out accurate information, but to root out both blatant and subtle disinformation that's on their sites. I think that they have work to do. We are certainly here to partner with them to get the job done. But clearly, we still have way too much disinformation spreading on those sites, and it presents a clear and present danger, I believe, to people who need to be protected from COVID and who could potentially get vaccinated.
I want to thank everybody for joining today, and we look forward to next week's briefings. Thank you.